For my practicum, I worked at MedStar Montgomery Medical Center as a volunteer in the nursing unit and a participant in the shadowing program, observing multiple departments of the hospital. As a volunteer, I transported patients like the example picture in the introduction, and I worked with all different types of medical staff, from nurses to doctors, to care for any patient that walked through the doors of our facility. As a shadow, I was able to sit down with doctors and hear them report on and improve hospital issues like sanitation and supply inventory, as well as hear the stats about what diagnoses were present in the hospital. I chose this site because it was my town's local hospital, among many urgent cares and private practices, and I wanted to see how a large medical facility operates to treat its public. I also wanted to serve my community and help the medical staff while experiencing more of the medical field firsthand to see if this is what I want to do with the rest of my life. In global public health, we have learned about the connections between health and culture and how to overall improve a community's health. Hospitals like the MedStar chain are designed to provide accessible modern medical care to surrounding areas to treat acute and chronic illnesses as well as promote proper sanitation. Especially with the coronavirus pandemic, different countries' healthcare systems have been exposed and put to the test, including ours. Many areas in the country, especially rural America, lack supplies, equipment, healthcare providers, and facilities, and those people are put at a public health disadvantage simply because they lack access to proper healthcare they deserve. MedStar Montgomery is located in Montgomery County, one of the wealthiest counties in America, yet I noticed many challenges my community faced in a shortage of supplies, medical staff, and rooms due to construction and appointments booked many months in advance. Due to the shortage of staff, physicians, nurses, and techs were overworked, putting themselves and their patients at risk due to exhaustion. If a higher income urban area like Montgomery County is experiencing these issues, then how are lower income areas in rural America working to make our healthcare system work? How can healthcare systems change to eliminate health inequalities and health inequities to provide the same standard of healthcare for all? I found that the answer to this is not as simple as I had believed. Some major takeaways from my experience are access to medical care is not as simple as providing the resources, because costs and accessibility are two major obstacles in the way, and until we can overcome these two barriers, then we can start to provide healthcare for all, from rural America with one small hospital to urban Montgomery County where there are 3 major hospitals within 10 miles of each other. A personal major takeaway I had is I learned there are so many more options than I had previously known for the medical field, and this experience solidified my desire to work in this field in order to help alleviate the burden put on overworked staff, as well as wanting to make people feel better and have a better life ahead of them. For my practicum experience, it was very important for me to choose something in my hometown that would give back to my community while helping me discover more about my future aspirations, and I did just that. Before this experience, the ultimate vision and goal I had for global health was achieving accessible healthcare for all. But now, having gone through this whole experience, my goal is not only achieving accessible healthcare for all, but also to bring more awareness to these inequalities and inequities that plague other countries and our healthcare system. I would like to give a special thanks to all the nurses, techs, and doctors that I shadowed at MedStar Montgomery, especially Dr. Kokotakis and the volunteer coordinator, Dr. Cheryl Potik, or Miss Cheryl Potik, I'm sorry. And I would also like to thank Reva, Haley, Dr. Maring, and Dr. Hyder for being wonderful instructors to me this past 2 years and for teaching me so many new concepts. And I would also like to thank Dr. Farmer for being my mentor throughout this experience and for looking over my poster, which I have presented to you today. Thank you so much.